So hence we try to introduce you to the minimally invasive quadriceps tendon graft harvest technique. So preoperatively, it is possible to predict the graft size on the sagittal MRI. We can go ahead and measure the length and the graft diameter of the quadriceps tendon preoperatively. So you can see in this image, we can see that the predicted thickness is 9.6 millimeters and the graft length. So for the landmarks, we have to go and mark the proximal pole of the patella and the VMO muscle. After which, we have to make a 2 centimeter transverse incision just above the superior pole of the patella. So you can see we're making the incision. Then we have to remove the pad of fat, which is commonly found just under the incision, because it enhances the visibility to the quadriceps tendon. Next, we have to insert the arthroscope and visualize the quadriceps tendon. We have to look at the direction of the quadriceps tendon, and it's always a good idea to put a needle in the direction. So usually it is in the direction of the ASIS. So a needle will help us to guide us our way through. Next is to insert the quadriceps cutting knife. So this is a knife which is sharp at 3 of its edges. So we push down the quadriceps tendon cutting knife in the direction of the needle, which is in the direction of the quadriceps tendon. So now you can see that we insert the knife, we push it downwards and forwards in the direction of the quadriceps tendon, which is guided by the needle that we have inserted earlier. So that is how we advance it. The next step is to take a scalpel and slowly, gently elevate the superficial layer of the quadriceps tendon from the deep layer. We also have to dissect our layers from both the sides as well as from the distal aspect. So next we can measure the length if we have taken the adequate length. After we know we have got the adequate length, we insert the quadriceps tendon stripper. This is an instrument where we can put in and go ahead through the direction of the graft. And this instrument again has a scale on the side, so you can, before you cut the graft, you can measure if you have the adequate length of the quadriceps tendon you have achieved. So once you know the adequate length is achieved, you can just press the button and the graft will be delivered out. After this, you can again put in the scope in the direction of the quadriceps tendon to see if you have breached the quadriceps tendon. Even if you have breached, it's okay. You can just put a few sutures and you can repair it. After this, you proceed with the graft harvest as usual for any other graft, and you proceed with the ACL surgery as the standard technique. So in our results, we did 21 patients in the last 5 years. The average graft diameter that we got was 9.2 millimeters, and the average graft length was 8.4 millimeters. So we could get a good graft in every year. In looking at the scores and return to sport, the average Stegner activity score was significantly improved. The Lysome knee score was also significantly improved. And if you look at the return to sport rates, there was 90% of return to sport, which was a very good result of the quadriceps tendon. One of the patients reported an anterior knee pain. One patient developed a wound site hematoma, both of which subsided with conservative management in the next 1 month. None of the patients required a revision ACL surgery till date, which is our follow-up duration of 2 years. So we conclude that this minimally invasive technique is a safe, efficient, and a reproducible technique to deliver a long, durable quadriceps tendon graft, minimizing the donor site morbidity and with very minimal complications. These are my references. Thank you. Yes.